Breastfeeding is a natural, beautiful process that provides optimal nutrition for your baby and fosters a deep emotional bond between mother and child. Yet, while breastfeeding is instinctive for newborns, it can be a learning experience for many mothers. The early days and weeks often bring questions, concerns, and sometimes unexpected challenges. Understanding breastfeeding techniques, recognizing your baby's cues, and having practical tips at your disposal can make this journey smoother and more rewarding. In the first hours after birth, skin-to-skin contact between mother and baby is highly encouraged. This close contact helps stimulate the baby's natural rooting and sucking reflexes and encourages the first feed. Ideally, the first breastfeeding session should occur within the first hour of life, as this is when babies are most alert and responsive. Don't worry if things don't go perfectly right away. Both you and your baby are learning together. Patience and gentle persistence are key. A successful breastfeeding experience starts with finding a comfortable position. There is no single correct way to hold your baby while nursing. What matters most is that both of you feel relaxed and supported. Common positions include the cradle hold, cross-cradle hold, football or clutch hold, and side-lying position. In the cradle hold, your baby's head rests in the crook of your arm, with their body facing yours. The cross-cradle hold offers more control of your baby's head, which is helpful for newborns or smaller babies. The football hold tucks your baby under your arm, like holding a football, which is particularly useful after a cesarean birth or for mothers with larger breasts. The side-lying position allows both you and your baby to rest while nursing, ideal for night feeds or when you need to relax. Regardless of the position you choose, proper latch-on is crucial. A good latch ensures your baby gets enough milk and helps prevent nipple soreness or damage. To achieve a deep latch, bring your baby to your breast, not the other way around, aligning their nose with your nipple. Wait for your baby to open their mouth wide, like a yawn. Then quickly bring them onto your breast, aiming the nipple toward the roof of their mouth. Your baby's lips should flare outward, covering much of the areola, not just the nipple. You should feel a gentle tugging sensation, but no pain. If you experience pinching or discomfort, gently break the suction by inserting your finger into the corner of your baby's mouth and try again. Feeding on demand is recommended for newborns, as their tiny stomachs require frequent small meals. Watch for early hunger cues such as smacking lips, sucking on hands, or turning their head with an open mouth. Rooting. Crying is a late sign of hunger and can make latching more difficult. In the first few weeks, most babies nurse 8 to 12 times in 24 hours, and cluster feeding, periods when your baby wants to nurse more frequently, is normal, especially during growth spurts. Trust your baby's instincts and let them guide the feeding schedule. Many mothers wonder how to know if their baby is getting enough milk. Signs of effective feeding include regular swallowing sounds during nursing, contentment after feeds, and a steady pattern of wet and soiled diapers. Typically, expect at least 6 wet diapers and 3 or more yellow stools per day by the time your baby is 5 days old. Steady weight gain is another positive indicator. If you have concerns about your baby's intake or output, don't hesitate to consult your healthcare provider or a lactation consultant. Breastfeeding can sometimes present challenges, especially in the early days. Sore nipples are a common complaint, often caused by an improper latch. Ensuring a deep latch and varying feeding positions can help reduce discomfort. Air drying your nipples after feeds and applying a few drops of expressed breast milk can promote healing. If pain persists or if you notice cracked or bleeding nipples, seek professional guidance promptly. Engorgement, when breasts become overly full, firm, and uncomfortable, can also occur, especially as your milk comes in. Frequent feeding, gentle breast massage, and warm compresses before feeds can provide relief. If your baby struggles to latch due to engorgement, hand express or pump a small amount of milk to soften the areola. Mastitis, an infection of the breast tissue, presents as painful swelling, redness, fever, and flu-like symptoms. Prompt treatment is essential. Continue breastfeeding or expressing milk from the affected breast, rest, apply warm compresses, and consult a healthcare provider if symptoms persist. Blocked ducts, which can lead to mastitis, may feel like tender lumps. Massaging the area and ensuring effective milk removal can help clear blockages. For some mothers, concerns about milk supply arise. Remember, the vast majority of women produce enough milk for their babies. Frequent and effective nursing is the best way to establish and maintain supply, as milk production works on a supply and demand basis. Avoid supplementing with formula unless medically necessary, as this can reduce your baby's time at the breast and decrease your milk supply. If you need to increase supply, try nursing more often, offering both breasts at each feed and practicing skin-to-skin contact. Some mothers find that certain foods, hydration, and rest support their milk production, though scientific evidence varies. Breastfeeding is not just about nutrition, it's also about comfort, security, and connection. Babies often nurse for reasons beyond hunger, such as soothing, teething, or seeking closeness. Allowing your baby to nurse for comfort is not spoiling them, rather, it meets their emotional and developmental needs. Trust your instincts and respond to your baby's cues. As you settle into a breastfeeding routine, remember to care for yourself as well. Breastfeeding burns extra calories, so a balanced diet and adequate hydration are important. Drink to thirst and keep healthy snacks and water within reach during feeds. Rest whenever possible, and don't hesitate to ask for help from family and friends. Emotional support and encouragement can make a significant difference in your breastfeeding journey. Returning to work or being away from your baby doesn't mean you have to stop breastfeeding. Many mothers successfully combine breastfeeding and pumping. Invest in a quality breast pump and learn how to express and store milk safely. Practice pumping a few weeks before returning to work to build a freezer stash and get comfortable with the process. Label and date all expressed milk and follow storage guidelines. Freshly expressed milk can be kept at room temperature for 4 hours, in the refrigerator for up to 4 days, and in the freezer for 6 months or more. Communicate with your employer about your needs. Many workplaces now offer accommodations for breastfeeding mothers. Nighttime breastfeeding can feel exhausting, but it is biologically normal and beneficial for both mother and baby. Night feeds help maintain milk supply and provide comfort and reassurance to your baby. Safe co-sleeping arrangements, such as room sharing and using a bedside bassinet, can make nighttime nursing easier. Always follow safe sleep guidelines to reduce the risk of sudden infant death syndrome, SIDS. Each breastfeeding journey is unique, and comparisons to others can be discouraging. Some mothers face challenges such as tongue tie, inverted nipples, or medical conditions that require specialized support. Lactation consultants, peer support groups, and online communities can be invaluable sources of information and encouragement. If you encounter difficulties, remember that seeking help is a sign of strength, not failure. Weaning, the process of transitioning your baby from breast to other forms of nourishment, is a personal decision, shaped by your baby's readiness and your own circumstances. The World Health Organization recommends exclusive breastfeeding for the first 6 months, with continued breastfeeding alongside complementary foods up to 2 years or beyond. When you and your baby are ready, wean gradually to allow both your bodies and emotions to adjust. Offer extra cuddles and comfort during this time, as the transition can be bittersweet. Cultural beliefs and societal attitudes can influence your breastfeeding experience. Some mothers feel pressure to breastfeed exclusively, while others encounter criticism for nursing in public. Remember that breastfeeding is your choice, and only you can decide what's best for you and your baby. Surround yourself with supportive people who respect your decisions and advocate for your needs. If you are breastfeeding multiples, have a premature baby, or face specific health considerations, tailored support is available. Premature or medically fragile infants may need special techniques, such as cup feeding or supplemental nursing systems, until they can effectively nurse at the breast. Mothers of twins or triplets can successfully breastfeed with planning, support, and flexibility. Don't hesitate to reach out to your healthcare team for individualized advice. Throughout your breastfeeding journey, celebrate your achievements, big and small. Whether you nurse for a few days, months, or years, you are giving your baby a precious gift. Breastfeeding is a dynamic relationship that evolves over time. What works today may change tomorrow. Stay flexible, trust your instincts, and remember that you are the expert on your baby. In summary, successful breastfeeding combines knowledge, technique, patience, and support. Start with skin-to-skin contact and early initiation. Focus on achieving a deep latch, feed on demand, and watch for signs of effective feeding. Address challenges promptly and seek help when needed. Prioritize self-care, stay informed, and connect with supportive communities. Most importantly, cherish the moments of closeness and connection that breastfeeding brings. Your journey is uniquely yours. Embrace it with confidence and love.